Good afternoon, everyone, and welcome to the third public webinar on electronic visit verification. As we continue through the webinar, if you could please submit your questions through the chat feature on the right-hand side of your screen. All phone lines will be muted throughout the presentation. If we are unable to address your question and comments today, we will take them back and address them through our frequently asked question document that is periodically updated on our EVV website. As a reminder, the Department of Human Services is required to implement EVV based on the requirements of the 21st Century Cures Act, and we are required to complete that implementation for personal care services by January 1st of 2020. We will also have to implement EVV for home health care services by 2023, but that is not currently included in our implementation. So we do continue to evaluate if Pennsylvania would apply for the good faith exemption, but at this time, we are confident with our ability to implement on time on January 1st, 2020. But because there's been a lot of interest in the good faith exemption, we just want to remind you that we do constantly evaluate whether or not something of that nature would be necessary. And if we do identify issues coming up on the implementation date of January 1st, we will consider taking needed steps. We are developing compliance expectations that will be communicated through a bulletin. It will be a joint bulletin between the Office of Long-Term Living and the Office of Developmental Programs. So keep an eye out for that. That will go through a public comment period based on each program office's typical bulletin procedures, and then it will be released once it's completed this fall. We do continue to review the CMS guidance that was recently released in August that allowed for some additional clarification on policies related to durable medical equipment and live-in exemptions and some other topics. And we are continuing to evaluate whether or not that guidance will impact our implementation. So for the services that we're implementing EVV for on January 1st of 2020, those services consist of the personal care services as defined in the Cures Act. And the Cures Act really focuses on services that include activities of daily living or instrumental activities of daily living. So for the Office of Long-Term Living waivers, this includes the personal assistance services, respite services if they take place in unlicensed settings, and participant-directed community support. And the waivers that fall under this requirement will include the Community Health Choices waiver, the OBRA waiver, and the Act 150 program. All of the individuals and providers currently in the aging waiver, attendant care waiver, and independence waiver are moving to CHC on January 1st of 2020. So it is expected that those providers are currently working towards implementing EVV to be active in CHC in the Phase 3 region on January 1st, rather than focus additional efforts on implementing for the aging waiver or the independence waiver at this time. For the Office of Developmental Programs, the Consolidated Person-Family Directed Support Waiver, Community Living Waiver, and the Intellectual Disability and Autism-Based Services, as well as the Adult Autism Waiver, will be required to implement EVV. And you can see that these services include companion, in-home and community support, respite in unlicensed settings, homemaker and chore, as well as for the autism waiver, community support and respite. As we've mentioned before, we are moving forward with an open vendor model. So this means that the Department of Human Services has developed a contract through our current Promise vendor contract with DXC to also expand to an EVV solution. So we will have a single EVV system available from the Department of Human Services at no cost to providers, as well as a data aggregator for those providers and managed care organizations who have chosen to use a different system. The DHS aggregator will allow us to consolidate all of the data from the EVV systems being used by providers, managed care organizations, and fiscal employer agents. That any provider looking to use an alternate system will need to not only capture the information required through the CARES Act, but they will also need to meet the system data requirements that are outlined in the technical specifications document. And today we will have John Kalivas from Sandata provide us with an overview of that technical specification document. So as you can see, this is just more of a visual explanation of the aggregator, as it will concentrate all of the EVV data into one searchable location that we also anticipate integrating with our MMIS or PROMIS system to better enhance our data and our claims process. One clarification on that though, if you are in community health choices and you're using an alternative system, because you are also submitting claims to the managed care organization, you will not send your alternate EVV data to the Sandata aggregator. You will actually be working with the MCO or the managed care organization to send your EVV data directly to them instead. So for the Office of Long-Term Living, if you do currently have your own alternate system, you will want to reach out to Sandata if you haven't already to begin integration activities. And their phone number is included for you here on the screen. This would include OBRA and Act 150 providers who are planning to use a separate EVV system to meet the EVV requirements. If you are in OBRA or Act 150 and you would like to use the Sandata system as your EVV solution, later on in the presentation we will have slides about the registration. The training registration is live, and the first training in person starts tomorrow. There will be multiple formats for you to be able to complete trainings, but you will need to complete training if you want to use the Sandata EVV system. So for providers who are currently in community health choices or who are in the aging, attendant care, and independence waiver and moving to CHC on January 1st, you will have two options. Your first option is to work with the managed care organizations to use the system they are offering, which is HHA Exchange, and they will offer training and assistance to begin using that system, but you'll need to reach out to them directly to begin that process. For providers using their own internal system for EVV and who are also participating in community health choices, as I mentioned earlier, you will need to send your EVV data to the MCO's system, not the Sandata system, unless you still have fee-for-service participants left in your care. If you need to contact HHA Exchange, we have included that email here as well. And lastly, for OLTL, the participant-directed services are included in the EVV implementation, and our vendor fiscal agent, Public Partnerships, has chosen to use their own proprietary system called Time for Care. Their system actually did go live on September 1st. They were able to implement early, and we wanted to take advantage of that just to allow people more time to adjust to the system, and that has been going well so far. We have identified a couple minor glitches here and there, but overall they have been extremely responsive in making sure that people get the assistance they need and additional training as we move forward.
Well, this is Chuck Frick from ODP. We're just going to go over some some of the requirements for ODP. Obviously, as the slides indicated earlier, waivers that will be affected are the consolidated PFDS, community living waivers, base services, and the adult autism waivers. For ODP, we really have 3 programs that we need to worry about. Obviously, the agency program, the vendor fiscal program, and the agency with choice program. For the agency program, obviously a provider can continue to use the open system, SAN data system, or they can use the alt EVV program. And also for the agency with choice program, they can, again, use the alt EVV program or use the SAN data system. And as Kristen said earlier, if you're using the alt EVV system, you need to, contact SAN data on those earlier slides. For the vendor fiscal model, that is we're working with PALCO. The system's called Authenticare. We're still working on the agreement with PALCO to get that up and running. So we hope to have that done shortly, and we hope to have training to be started within the next couple of weeks. Okay. Again, PALCO will be using an alternative system. It's called Authenticare. And again, we'll be providing updates in the future. All right, and again, as earlier slides, here's the information for the alt EVV system. We need to encourage ODP providers to contact the alt EVV system. We're looking at the signups, and we see a lot of providers or agencies are still not contacting SAN data to have their, to review the technical specifications with them. So we encourage you to call them as soon as possible.
You want me to answer?
Okay, so we're going to take a minute before we get into the technical specifications with SAN data and with John. We're going to take some questions that we've been getting, and we'll answer a few questions, and we'll start the technical specification process.
So one of the questions that we received is if we can clarify whether the entire Social Security number or just the last 5 digits needs to be sent through the EVV system. So the expectation is that some type of unique identifier be used for providers that can link them across systems. This is particularly important because we are using an open vendor model. So at this time, the solution is that the Department of Human Services is pursuing the establishment of a unique ID registry so that all workers will be able to obtain a unique ID through that registry. Because we began implementing the unique ID registry and we ran into some additional system issues, we are still working on enhancements before we expand it to the wider population using the EVV system. So at this time, if your worker has not yet obtained a unique ID, for the intermediary, you can use the last 5 digits of the Social Security number. It will be expected that eventually all workers obtain that unique ID, but at this time, the last 5 digits of the Social Security number will suffice. We did also receive a question as to whether or not caregivers that live with the participant will be exempt from EVV based on CMS guidance. CMS did release guidance addressing live-in caregivers, but that guidance did also allow discretion of the state based on the implementation and operational needs of the state. We are still evaluating that clarification from CMS.
We got a question, can extension for good cause be requested for just one group of individuals? And again, the group of individuals we're talking about here is the vendor fiscal model. Obviously, we had some delays in the program process and starting the vendor fiscal process. And obviously, we want to ensure that it's a smooth transition and we're not, So I think we're going to keep working with, Palco, and since the training has not started yet, which is a little bit worrisome, and to be honest with you, that, we have to probably allow for some trial runs and stuff like that before we get started. Obviously, we're still committed to the time frames that we have set, but, in our time frame for, rolling out the Authenticare with Palco is going to be shortened. But we want to make sure that is, that everyone's good to go before we have any kind of requirements that we set in. So we'll have to review it as it, day by day, week by week, and see how we're doing to make judgment calls. So it's really kind of hard to answer a question based on how quickly the training can be set up and how people are feeling and stuff like that. But we're going to be aware of this, and we're not going to put anybody in an undue situation that's not feasible. As far as the next question we have, where are you on rounding policy for ODP waivers?
Our policy on rounding has not changed. You can get more details on rounding within the ODP technical guidance that was issued, I don't know, what was it, a week ago?
Correct.
And it's currently posted on the DHS, Department of Human Services, EVV webpage.
I just want to, Jen Grimm and put a technical guide out there for ODP, so please make sure you look at that, okay? And now we got to take some more questions?
Okay, we're going to answer a few more questions, and then we want to get into the technical specifications. One question here is, can you clarify what training is required for provider agencies who are using a third-party system? So for provider agencies who are using a third-party system and need to integrate with SAN data, so this would be our fee-for-service providers, there will be an aggregator training available to providers from SAN data. You will also be required to complete the certification process through SAN data, but the other trainings that are being offered are not required. Question here in regards to the January 1st rate increase for personal assistance services in the Office of Long-Term Living, and whether or not this will also apply to the attendant care waiver. So the attendant care waiver ends on December 31st of this year, and the rate increase takes effect January 1st. The rate increase will apply to the OBRA waiver. We'll also expect that rate increase is passed down from the Community Health Choices Managed Care Organizations, but the attendant care waiver will not see that increase. So there's another question here. As an aging waiver provider in the Office of Long-Term Living, are we allowed to use the SAN data system? So if you are an aging waiver provider only, all of your participants are moving into Community Health Choices. Since they are all moving into Community Health Choices, you will either need to use the HHA exchange system being offered by the managed care organizations or an alternative system you're choosing. But the SAN data DHS system has not been developed to send data to the managed care organization in Community Health Choices. And then the last question here was just regarding whether or not we will remove the prudent pay requirements whenever we implement EVV, and we will not. Prudent pay requirements will remain the same. All right. You can continue to send in questions, but at this time we're going to move on to the presentation from SANdata. And we want to introduce John Kalivas, who's going to go over the technical specification addendum.
Good afternoon, everyone. Thanks for having me. My name is John Kalivas with SANdata Technologies. My role here for SANdata was the payer specification or oversight solution design to allow the EVV systems to align to the needs for the Pennsylvania offices and programs. So what we're going to do today, as the bullets say here, we're going to review the technical specification. I'm not going to do it in a ton of detail. I just want to give an overview how to navigate the technical specification because there's two documents. The first document is a generic technical specification that provides the overview and interaction on how you're going to send the data to SANdata. The addendum, or the accompanying document, defines the Pennsylvania specific items that need to occur. How do we define a provider or provider agency? How do we define a client or member? And then the rules associated with it. What service codes and modifiers or combination of service code and modifiers need to be submitted when a visit has become verified or completed, and aligns to and captures the 6 cures elements as well. So both of the documents can be found on the DHS website under alternate EVV. We did recently publish an update to the addendum. We included a couple modifications that allows the intake of data to now include the modifier as well as the service code, so it can support the needs from a billing perspective and allow you to report accurately what was captured. So if you, Bob or Kristen or Chuck, can you guys make me the presenter and I'll pull up the documents?
Yeah, give us 1 minute, please, and we'll get that right to you.
Thank you. So while we're doing that, again, I'm going to just do a quick overview, not a quick overview, but an overview of the documentation. Again, how to interact with the SANdata systems and send your information from an alternate EVV system. But as Kristen and Chuck both mentioned along the way, we do encourage you to reach out to the SANdata technical teams and support teams to help you through the process. They will not only get you signed up for the small training that will occur, but they'll also be able to go through a deeper dive with each of you as you work through the implementation. So how can you test to ensure that the systems integrate correctly? How can we help you along the way where you may have questions and or some of the data doesn't quite align to what you're providing? But the team is there, they're very familiar with the documentation, and they'll be able to support you and help you as you go through your implementation.
Yeah, John, do you have your individual link to bring up your presentation?
Yeah, I just... Can you guys verify that you can see my screen and you're seeing the technical specification?
We are not seeing it yet. Just give it a minute. Just give it 1 minute, please.
Yep.
While we're waiting on the transition to the other presentation, I just want to take an opportunity to answer some of the questions that we've received about the unique ID. And at this time, only workers and participant-directed programs through the public partnerships have received the unique ID. When the system is ready, which should be in the coming weeks, we will send out additional instructions on how to obtain that unique ID. But workers will be able to use the same ID throughout all systems. So if you have a worker who is already in the participant-directed programs, they have a unique ID, you can begin using that in your EVV system. But I do apologize for the delay. I do understand the difficulty in having the EVV implementation not aligned with the unique ID implementation. But we are doing our best to work out all of the bugs before we provide you with a system that is overly burdensome, or at least try to minimize that burden.
Kristen or Chuck, how about now? Are you seeing my screen? It shows that it's viewing to the audience.
We're getting different feedback right now, so we're still have to look at it. We feel like your screen is probably being shown to participants out there, but we're not seeing it in this office.
Okay.
So, John, why don't you go ahead and get started, okay?
Okay, we'll do. Thanks everybody, and apologize for the delays. So what you're looking at here, one of the documents that are found on the DHS website, this is the SANdata technical specification for the Open EVV series or interface. This document, as I mentioned, is the generic specification. It includes things like transmission protocols, data formats, field formats, as well as the generic definition from a data element perspective. As we scroll down here a little bit, the intent is to provide, again, that generalized overview of the information. So section 1 is the overview, intended target, the transmission frequencies, data types, when a record would be rejected, when a new record is required to be sent, what the transmission methods are, and then the acknowledgement or transaction IDs. Because this works as a web service, it's a RESTful web service deployed on the internet, there is an acknowledgement back. So when a visit is captured in an alternate EVV system, it's sent to SANdata. We do a series of validations and verifications, including the provider agency ID that was issued by PADHS, the client or member's Medicaid ID, MAID that was issued to that person, that there's a valid start clock in or start time for the visit, that there's a valid end time for that visit, and we know specifically what service code was included or what service was provided at the time of that visit. Along with that, we also need to know who the caregiver was that provided that. As Kristen mentioned, we're working through some enhancements that will make it easier for the team to track and maintain workers in the field and be able to update the SANdata systems as well as alternate systems with the PADHS issued caregiver ID. Section 2 of the generic specification provides the field information. So this is provider, this is client, and client in the SANdata world is the member information. That's who received the service. Section 2.6 is responsible party. So if you had a designee for that particular client because they were unable to authorize or approve the service, you could pass designee information. The employee is the caregiver, so who provided service to that individual in the field. And then section 2.8, 2.9, 210, and 211 are the visit specific information. So in the SANdata side, when care is provided to a worker in the field, it's recorded as a visit. Again, the visit contains the cure specific elements to make us adhere to the Cures Act. And just to restate, it's the who received service from what caregiver, the date and time for that, as well as the service that was provided. So that's just a general overview of what the technical specification looks like. What we did as we designed the program is we build what we call an addendum. The addendum provides, also found on the DHS EVV website under the alternate EVV section, is the program specific values that are required to be collected or gathered or transmitted in order to more accurately determine which members associated with which program, and again, what service code was available within that offering. So this is the PADHS third-party EVV. This is specific for the program offices, ODP and OLTL, and it's amendment or addendum 1.11. As you scroll down, there's version history. You see my name in here a number of times, but it gives you what changes were updated. The last change here on 9.9 was to add or include the modifiers or the ability to pass modifiers so that we can accurately report if a claim was submitted for a particular service, that if it was submitted with the service code and modifier, when we get to claims validation or verification of the encounter, that we're accurately able to reflect that and measure that. But as you get into the table of contents, you'll see that this version of the document is much smaller than the large generic spec. Again, it's meant to be targeted and focused on the Pennsylvania specific design for their EVV solution. Section 1 is the overview, much smaller, but in section 2 is where we call out the PA specific requirements. You'll see as you read through the individual columns that where there's a reference to a lookup value, that is noted within the column itself, and the appendices or appendix down below with assumptions, service code, and exceptions detail out the specific value. So you'll see some references or relationships as we get into the specifics of the file. So Kristen or Chuck, before we jump into the specific fields, because I just want to point out a couple of specifics that the team will have to take notice of, or the alt-EVV users will have to take notice of. Are there any questions that were submitted that we can answer quickly?
No, we haven't received any questions related to the technical specifications at this time.
Okay, let's jump down. Section 1 is the overview. Section 2 are the PA/DHS specific requirements. As Kristen and Chuck had mentioned, when you're using an alternate system, we do want to collect or aggregate the data on the SANdata side, making it available from across the program holistically. Those users that have CHC populations and or working with the MCOs, your information will get transmitted through an interface that's being created between SANdata and the HHA exchange system directly. For those agencies that are going to interact and send data directly to SANdata, this is the addendum that will help you define the data that needs to be sent to SANdata to be collected into the aggregator. In section 3 is the third-party EVV API. This section details out in detail the element, a quick description, the maximum length for that element, And then the column to the far right is the expected value. What we do here is we align for those users that are using the SANdata EVV system to collect their visit information that adheres to the Pennsylvania design. We do the same for the third-party interface. So the provider qualifier and the provider ID, the qualifier is the string value Medicaid ID, and in column index 2 provider ID is the 9-digit provider ID. This is the unique agency ID that was responsible or collected this visit information. And I won't go into detail into each of these columns because as I mentioned, you can get that information and go into that amount of detail with the SANdata technical team or the support teams as you work through the interface, but do want to point out a couple additional clarifications from an expected value perspective. So in section 2 or item 2 is the client information. Client, again, remember, equals member in the SANdata systems. The client Medicaid ID is the unique identifier for that client that ties back or links back to data that's been provided by the PADHS systems that we verify and validate is eligible to receive services for the program. So you'll have to supply the 10-digit Medicaid ID in that field. Sequence ID is a live data format, and it provides the format here as well as time zones. The next section is client payer. So what the client payer section does for us is to identify the appropriate program office for that individual. So the payer IDs are known as PA ODP and PA OLTL. And then the payer program is just the specific program office associated with that client. The values, again, tie the member to the office that they are eligible to receive service under. The data that you'll send is just the string value representation of that value. So there's no lookup, there's no alternate ID. If it's an ODP member, the payer ID will be PA ODP, and the payer program would be ODP. As we get into client addresses, things that are noted as required are required to be passed. We need an address, address one field, a city, state, and zip for the individual or for the member to be stored within the SANdata systems. Sections that are noted as optional. They are optional because they're not required. If you do choose to send a phone number, we need both of the data elements. If you choose not to send it, the entire section or the entire element can be omitted or skipped from processing. Employee, again, in the SANdata world, is the caregiver. So who provided service, and you'll see here we have last 5 of Social Security where the PADHS unique registry ID is not available. As Kristen mentioned, we're actively working on coming up with a solution so that the ultimately the Social Security number, the last 5 of the Social Security number, can be omitted, and we only move forward with the PADHS unique registry ID. That is one of the high priority items for our end, as well as from an overall program perspective, and we'll be actively communicating when those changes and updates will get in place. As we scroll down, it's the visit information. So the visit general section is information about the visit itself. It tells us a unique ID for the visit itself. This is normally the ID within the alternate EVV system. Who provided the service? This unique qualifier points back to the other section that allows us to identify that care worker so that we're not passing duplicate first names, last names, etc. in the payload. We're just passing a pointer or a lookup to that value. Same for the client information. Within the visit, we're going to pass the client ID, which is the Medicaid ID, and that links back to give us the other details for the client or the member who received that service. Payer information aligns the same way. And here you can see on section 11 within the visit, we need the procedure code and the modifiers. So the procedure code, the reference is in Appendix 4.2, and it lists all the specific HCPCS codes that have been identified by the PADHS offices as approved services to be collected for the program. Modifiers 1 and 2, 3, and 4. As we scroll a little bit farther, we have calls. So in the SAN data system, a visit is captured in 2 segments. We do the first one as a call in, clock in, or sign in activity. It tells us which caregiver gave what service to what member at what location at what time. That's an individual record in the SAN data side. The second call is the call out activities. When did the visit end? Did you still provide the same services? Was it verified while you were on site? And what was your location at the time of clock out? So the 2 calls on the SAN data side equal the visit. So we have a clock in and a clock out. If your visit encountered an exception, the visit exception acknowledgement section is listed here. If for whatever reason a caregiver did a clock in but failed to clock out and you needed to manually enter a clock out time, the exception would show that there was a clock out exception fired for that visit. The required elements and those exceptions that have been defined for the PADHS program are listed in Appendix 4.4. So anytime you see in the right column where you have an expected value and it's a reference to an appendix, it means that there was more than one value available there. And you'll have to do a mapping exercise to ensure that your system matches to the expected values on the SAN data aggregator side. And then the last section is visit changes. This is any change that's made to a visit after it was initially created. We know that not in all cases the visit will be perfect and complete the first time. So you may have a visit that got collected, it moved into a completed or verified state. Potentially a claim was sent for billing and there was an error and you needed to go back and update it. The start date and end date were incorrect. Something was gathered incorrectly. What the change does is tell us from the original record that was sent to us and to the SAN data aggregator, what information was changed, who made that change, and why it was changed. We know that there's times where changes do need to occur. We don't want to make this system not flexible enough to capture those changes, and this is a way for us to manage those changes. And then we get into the appendices. As I mentioned, the appendices here show the payer program offices, the code, as well as any modifiers that are specifically available for those, and that will be authorized from an authorization perspective for an individual. So want to pause there. Kristen, Chuck, anybody on that side, any questions that came up while we went through that?
Hang on.
Wait.
Just a second, John. We're just reviewing. We received quite a few questions, and we're just reviewing to see if any of them are specifically related to what you just reviewed.
Okay.
So John, at this time, I'm not seeing any technical specification questions, but we can give it a few minutes. There's usually a bit of a delay. We can answer some other questions and wait and see if we see anything, if that's okay.
That works perfectly fine. Thank you.
So we'll continue on with a few more questions before we move back into the presentation. We received some questions regarding HHA Exchange. If you are using HHA Exchange with the MCOs, you are not required to attend the SANDATA training that begins tomorrow. You may have the option to complete the aggregator training with SANDATA, but you do not need to attend the SANDATA system training. You also don't necessarily need to make any changes to the system. You just need to work with the MCOs to make sure that if there are any changes moving forward, that you work with them to make sure that you meet those needs. So another question here we had is the DHS EVV system different from SANDATA? Yes. So the DHS EVV system being offered for fee-for-service programs at no cost is the SANDATA system. HHA Exchange is the system being offered by the managed care organizations for providers in CHC. We also had a question about whether or not you would need to make any changes to your 837 file to complete your claims process. There will be no changes to the claims process and the 837 process because we are integrating our EVV system with Promise and we are collecting the additional data elements needed to do that. The system will be able to match to claims without you needing to modify your 837.
All right. For ODP, the agency with choice model, will the managing employer still be required to sign date and document when EVV is implemented? So basically right now, part of the responsibility of the managing employer is to review and sign the timesheets. Will that be required when we go through EVV? We are looking at it. We do not feel that it's that you would need to the managing employer would need to sign a timesheet since the EVV system collects data and stuff like that. But one of the things we need to work with is that we are doing a new bulletin right now, and we have to implement that wording just right so we're not, so everyone's pretty much happy with the wording that we put into the bulletin. So right now we're looking that it would not be a requirement for the managing employer to sign off on anything if the system is going through the EVV system, but we need to get some provider feedback and just make sure we're on the right path before we put it into the bulletin. Thank you.
Okay, John, we did receive a question on the technical specifications, and then we also received a question about SANDATA's security. So the first question was just requesting additional information on the security protocol that would ensure that this type of data is secure in the SANDATA system. And then the second question is if they were to skip an optional data element, are they expected to hold a place in the file?
So I'll answer the first or the second portion of that first. So optional data elements, you do not need to hold a place for any optional ones. You only submit them if you're in fact going to send them. So the instance that I said during the program, and the one that's easiest to reflect, is client phone number or member's phone number. If you have a phone number and you're going to send it, both elements are required. If you're not going to send a phone number, neither one of the elements, you can exclude both of those from being sent. From a security perspective, we do two things for authentication and security. So part of the onboarding process is to provide you with a unique username and password that'll be used to securely authenticate you to receive data into the service that's deployed on the SANDATA side. Along with that, that request is also being securely transmitted via HTTPS or the web service protocols. So it's securely encrypted in transit. We uncrypt it on the SANDATA side. We verify that the user ID and password, or the credentials that were provided, are a valid agency that can send data before we encrypt or before we inspect any of the elements. If any of those pieces fail, the entire request gets rejected and sent back until it passes those security protocols.
Thank you, John. So at this time, we're going to proceed with the rest of our presentation, and we will continue to collect and answer questions at the end. So the SANDATA EVV system will be going live. We will have a soft launch in October. The goal is for providers to start using the EVV system in October as they become either trained and credentialed by SANDATA, or they begin working with the managed care organizations. And that way, that'll give us this fall to really work out any kinks or issues and provide additional technical assistance to providers who are having difficulties throughout the fall, so everyone's prepared for the full implementation date of January 1st, 2020. As a reminder, the technical specification documents and the addendums are available on the EVV website. And we've also added additional We've also updated the FAQ document on the website. Bear with us just 1 second, the slides are not moving forward. Oh, all right. So you can access the updated FAQ on our website, and that has integrated a lot of the questions that we have been receiving through these public meetings over the last few months. And then you can also find additional information on the SANDATA EVV training that begins tomorrow. So if you are going to use the SANDATA EVV system, training is mandatory. You will not be able to access the system until you complete one of the available trainings. So there are, as an overall approach, we are moving forward with a train the trainer model. So for our in-person trainings, we are requesting that agencies only send 2 participants to the in-person trainings, and then they can bring back that knowledge and what they've learned to train the caregivers at the agency. In addition to the in-person training, there will also be instructor-led webinars and self-paced training, and I'll get into that in just a second. We do suggest that for the 2 people you send from your agency to the in-person training, It'd be someone who is most likely going to be the billing administrator or working with the system in the back office of your agency, and then someone who is an administrator who can not only manage the setup, but who can also assist with staff training. So in addition to those instructor-led classroom sessions that start tomorrow, instructor-led webinars also start tomorrow. So you can send additional staff to the webinars that will be approximately 2 hours in length, and they will be in 3 sessions. In addition to those, there's also the self-paced training. So if the times of either the webinars or the in-person trainings don't work for you, or you want to have additional staff access to self-paced training, that's a really good opportunity to use something on your own time. So as we mentioned before, this is just a timeline with our soft launch starting here in October and the full implementation in January based on the requirements of the CARES Act. So in October, when you begin using the EVV system, you will want to review your remittance advice that you receive from Promise to monitor any claims issues that might be identified so you can address those proactively. That will give you a really good idea too as to how your EVV utilization is progressing in comparison to your claims. And with that, we're just going to go on hold for a few minutes to gather more questions. And one clarification regarding reviewing your remittance advice and claims. At this time, they will not be claims denials. They will be pay and list edits. But what we really encourage you to heed those edits and kind of learn to work through those in case things change in the future. Okay, John, are you still there?
Yes, I am.
Great. We have a few more text spec questions. We have a question regarding clocking in and clocking out. So does the clock out go on a separate line? Does the clock out have one line and the clock in have a different line on different rows?
It does. So as you're reading the specification from an agency perspective, the visit general section is a summary of the visit. So it includes all the elements to summarize the visit. The calls section is where the 2 separate records come from. One is the clock in or visit time in, and the second is the clock out. The reason for that is we collect location at the time of clock in and location at the time of clock out. Not that they have to match or not that they have to be the same, but we like to know where you were at the time of clock in and where the caregiver was at the time of clock out, and that allows us to record those 2 separate elements. But yes, they are in fact two different records.
Thank you, John. Another question we received is, has the percentage of exceptions acceptable been defined yet? So when it comes to compliance, we have not yet defined, an exceptional or an acceptable rate of exceptions. We are doing our best to approach this as flexibly as possible and not to create additional burden for providers. So we are still evaluating how we want to handle exceptions, but we will provide clarification in the future. Okay, John, we have an additional question here regarding the turnaround time on whether or not a submission is approved or rejected.
Because the transmission's via web service, it is in real time. So you'll get a response or acknowledgement back whether it was accepted or rejected, and when it is rejected, reason for rejection. And that's defined if you look at the technical specification from a generic perspective. You'll see in there the transmission frequency and response times, as well as the message that will be returned either upon success or denial. And I will just encourage you that if you do have those specific questions, if you can call into the SANdata support line, they can help and talk through that topic with you in greater detail, and for as long as needed to ensure how it will work on your end.
So we had a question regarding whether or not the EVV mandate applies to private pay clients. It does not. EVV is only applicable, or the EVV mandate is only applicable to Medicaid-funded services.
John, this is a question directed towards SANdata. The inquirer says, how is SANdata anticipating receiving services of SAN to date?
So if I understood the question correctly, it would be visit that started on the 22nd and concluded on the 23rd. And if that's the basis of it, we consider at SANdata a visit is a visit containing 2 calls or 2 call records. So the visit general information would be a summary of that visit. Clocked in at 11 o'clock p.m. on the 22nd as my first clock in or call, and clocked out at 3 o'clock in the morning on the 23rd. So the visit general would have 11 o'clock p.m. 0922 for the clock in, 3 o'clock a.m. 0923 for the clock out with the 2 visit records. We do not break visits at midnight. We just consider them a continuous visit record.
Here's another one, John. What is the average time per 8-hour shift that SANdata expects a caregiver to use in putting the information for one client into the system?
So from a SANdata perspective, there's no need to interact with the system during the time of care. We provide a SANdata Mobile Connect for those using the Mobile Connect application, but for your alt EVV systems, we're not looking for continuous input or integration over the time that the caregiver is there. We specifically target the 2 points in time to minimize the impact to the caregivers in the field. So we're really looking for what activities occurred at the time of clock in. Selection of members, selection of service code, what the date was from a verification perspective, and who am I as a caregiver. And then clock out activities. What did I do during the visit? If I do have visit notes, what time did I clock out? Where was I from a location perspective? Are gathered at the time of clock out, but we don't expect continuous or system integration over any period of time while care is being rendered or provided.
Thank you, John. So additional questions that we received. We've received several questions about if people will be able to access the materials from this webinar. So the webinar recording will be posted in the coming days, as well as the PowerPoint presentation, and the technical specification addendum is already on the website. So you will be able to access all of those things on the DHS EVV website. We've also received several questions regarding when providers can start the aggregator training if they're using a third-party system with SANdata. So if you are going to use a third-party system, you will access that aggregator training once you have completed the credentialing process with SANdata. That is through a learning management system, and SANdata will provide you with access once you've completed their onboarding process.
For ODP, we had a question about how does the system approve a 2-to-1 service. The system, we have guidance here on the DHS website, the Electronic Visit Verification Technical Guide, and on page 12, we kind of go step by step on how the 2-to-1 service works. I think it would be a little complicated to try to talk that through right now, so just go to page 12 in the guidance, and it really gives some good examples on how the 2-to-1 service works for ODP. Okay. I just wanted to clarify a little bit that there has to be 2 workers that check in during that time frame. So I give it a quick example, I guess, is if a DSP checks in at 4:55 and checks out at 5:10, then the DSP and another DSP worker, B, checks in at 5 p.m. and checks out at 5. The common check-in time for both those workers is 5 o'clock. So that would be the check-in time. So one starts a little earlier, one starts, both 5, and vice versa. When they both check out, they're going to look. It's going to look for the common time for the checkout, and so based on that, that's when the check-in and checkout will be.
So ultimately, if it's 2-to-1 service, there has to be at least 2 staff with that participant for that time to count. Once one of those direct caregivers is checked out, it's no longer a 2-to-1 service.
So So there was another question we received regarding the date that providers will be able to begin using the SANdata system, if that is the system they're choosing to use for EVV. And you will be able to begin using that system once you have completed the training requirements, whether it is through the classroom training, the instructor-led webinars, or the self-paced webinars. And then after you complete that, you will receive your credentials to begin using the system. Another question is in regards to whether or not the EVV system will capture the location of service, and if the visit starts at one location and moves to another, does that cause any problem? So services should be continue to be provided as they are today. If you have a service that starts at the home and it ends outside of the home, that's absolutely fine. The EVV system will collect the location because it is a required field in the Cures Act, but we have not set up any limitations to where a location outside of the home would inhibit that service from being provided or from the provider being paid. So we just ask that you collect the location as it is required, but it does not. We did not build any strict requirements on limiting location of service. That can continue as always.
So another question we received, if a staff member forgets to clock in but remembers to clock out, will the out punch be interpreted as an in punch and then show as an exception with no out punch? No. In the SANdata EVV solution, you are indicating whether it is a check-in or a check-out. If you're using the telephony version, it's through prompts. You're specifying if it's a clock in or a clock out. Obviously, if there is a visit that is missing either or, a punch in or a punch out, then it will trigger a visit exception as it's a required data element for Cures compliance. But know that a clock in will not be misinterpreted as a clock out. If they're using the SANdata mobile application for the visit capture, it will ask them to do a check-in first. So if they have not checked in at the time of their actual arrival at the point of care, they will put in a check-in time, and they'll have to contact the agency and let them know that that time needs corrected, and let them know what their actual time of arrival was.
So the question here is whether or not skilled nursing services are required to implement EVV on 1/1/2020. They are not. Nursing services will most likely fall under the home health implementation in 2023, but we have not begun approaching that implementation at this time. Right now, only personal care services, which include personal assistance services, respite, and the other related services we listed earlier are included. There was another question here to clarify how many staff can attend the training. So we request that only 2 staff members attend the live trainings being offered, but other staff, in addition to the 2 designated for the live training, can also access the web-based training that is self-paced, so you can access that at any time. So we did receive a question regarding service notes. The EVV system through SANdata, as well as many EVV vendors, do offer the ability to enter in notes about the visit. We do not have any specific requirements for notes to be provided, but there is the ability to add those notes. The one time where it's really helpful to use those notes is whenever you need to make any corrections or edits to the entry. You'll have the opportunity to either have yourself or your staff make notes to kind of, document why that edit was being made. Along with those lines, we received another question regarding, how frequently will it be acceptable for employers or providers to alter the EVV visits? So we really encourage providers, as you get used to the system, to do your best not to manually edit your visits. We do understand that as we implement, this is going to be a learning experience for everyone, and there will be times where you need to, add a clock in or clock out because someone forgot, or make those edits as people are getting used to it. But over time, we really encourage you to, take advantage of the fact that this system really can become self-automated and ease some of the burden of your back office tasks if it's used appropriately. But at this time, we have not established any limitations on the edits. So there's another question here as to whether or not the state will consider delaying the denial of claims past January. At this time, we have not released any deadline of when we will begin to deny claims. When we do establish that date, we will provide additional information. But at this time, throughout the soft launch, we are only doing pay and list edits. So we received a question as to if the service takes place entirely in the community, does it need to use EVV based on CMS guidance? So we have our services that are included under the EVV requirements that we outlined in the beginning of this presentation are required to use EVV. We have excluded services that are only provided in the community. One of those was the respite camp service provided from the Office of Developmental Programs. Because that was only provided in the community, that was removed from EVV requirements. However, personal assistance services, respite, and other services that we listed earlier are required to use EVV because they are predominantly provided in the home. And so if on a given day personal assistance services started and ended in the community, you would still need to use EVV because we are requiring the use of EVV based on the service. Bear with us, we're just collecting some additional questions.
Another question we received is, what is the aggregator training? How do we access it? How do we contact SANdata direct? And do we contact SANdata directly for the credentialing process? The aggregator training, as mentioned previously, will become available once the provider agency has completed its alt EVV certification process. To initiate that process, the provider agency should be reaching out to the alt EVV helpline made available on our EVV webpage. It's accessible by telephone as well as by email. The aggregator training itself will be delivered online at a self-paced forum in our learning management system. John, are you still on the line?
Yes, I'm here.
Here's a question I think you can help answer with. It says, how does this work with consolidation of claims for the data service? For example, 3 staff members entered in IHCS, that's a type of service, in-home community support, but each one is a separate line in SANdata, but one claim in Promise. So they just want to understand that a little better.
Yeah, so if you're submitting a rolled up or date span claim for a particular service, how the claims validation piece will work is we will look across the day for all visits associated with that particular caregiver member and service code and consolidate those together to find a number of units for a verified visit or a claims validation match. And simple 3 check-ins, each of 15 minutes, which equates to 1 unit, occurred during a single day. You submit a claim for 3 units. What SANdata will do is we'll match the 3 visits or collect the 3 visits for that particular span, find that it was 45 minutes in total, which equates to the 3 units, and mark that as verified or valid for payment.
So we are waiting on any additional questions, but I just wanted to provide a reminder that the next public meeting will be on October 22nd, and then we will also have one in November on November 26th. So if you want to register for those, please go to the EVV website. And as always, if you have additional questions after this meeting, you can send them to our resource account listed on the screen. Just bear with us and we'll just wait for additional questions. We did get a note that some providers are having difficulty finding documents on the website. If you go to the main DHS EVV website and you're unable to locate documents you're looking for, please look at the right side of the screen for the related topics links. And quite a few of the documents, including the upcoming meeting registration, the technical specifications, and the Office of Developmental Programs technical guidance are listed through those related topics links.
Yeah, the technical ODP.
At this time, we do not have any additional questions, so we're going to end the webinar for today. As we mentioned before, if you have additional questions that you have that were not answered, please send them to the resource account and we will answer you directly. Thank you and have a great day.